Recording in progress.
Okay, let's do speaker with. Several of you have already asked me for permission to record. I just wanted to put that out there for anybody else here who would like to record. Let me know. Be happy to give you the ability to do that. We do provide it afterwards, as most of you know.
Hi, Jay. Carissa with 3TV and CBS 5. Can I record?
Should be good.
Jay, Caitlin Keenan, Cronkite News. May I please record as well?
You got it. So we're just waiting for the two people who actually have the information to share with you. So bear with us, and David Thomas and Josh the Bear will be here in a moment. Hey, Josh.
Hey.
David did confirm he'd be joining us, so
Oh, good. Okay. Great.
oh, there's David. Okay, Mr. Thomas has joined us, so let's get ourselves started. All of you, if you'll put yourself on mute if I haven't already. Any of you who would like to record, if you haven't asked already, just shoot me a note in the chat. Again, we do provide it afterwards. So if you choose not to and you think better of it later, you can reach out to us and get a recording. With that said, we will have comments from Dr. Joshua LeBaire, the Executive Director of ASU's Biodesign Institute, and from David Thomas, who is the CEO of ASU Enterprise Partners, and he's the Operational Site Director of both State Farm, Phoenix Muni, and frankly, the testing sites that ASU runs as well. So he'll have a report on vaccinations. So with that, I'm going to turn it over to Dr. LeBaire to cover trends in COVID cases in Arizona, and we will open it to questions and answers after David Thomas follows up. Thank you.
Great. All right. Well, good morning, everyone. I'm going to switch over to sharing my screen with you for a second, just to give you a quick, you need to make me a host there.
Oh, sorry about that. There you go.
There we go. All right. I'm going to just cover a couple of quick numbers here for everybody. So as everybody knows, and Arizona is this one here in maroon. The numbers in Arizona have dropped considerably over the last couple weeks, and that's true for the country as well. Although I would say, looking at the numbers now, both in Arizona and in the country, it seems to have stalled, so that we were dropping quite a bit. We're still hovering above 1,000 new cases a day for the 7-day trailing average, and that doesn't seem to be going down right away. So that it's a little bit reminiscent of where we were back in September, when the numbers were dropping and then kind of stopped dropping. The difference being that in September, the numbers dropped down to around 400 new cases a day, whereas now we're stalling above 1,000 new cases a day. So that's a little bit more worrisome. I would be much happier if we could get things well below that 1,000 new cases a day mark. I think it also bears pointing out that we are not running as many tests as we used to be. Here is an image of where we are with the testing. And you can see that we're not really running as many tests as I'd like. We're in terms of percentage positive tests, and that's shown here. The 7-day trailing average has us at around 12% positive tests. And we like to see the percent positive test around 5%. So that means increasing testing to the point where the positivity rate is around 5%. So I would love to see us doing more testing than we're currently doing. In our track record, we have clearly observed that the more testing we do, the overall lower burden of infections there are. Testing seems to remind people to behave well, and you tend to see fewer cases. In fact, we are just pulling together numbers for a publication, and I'll cover that in a moment, and that suggests that same effect. Here are just some numbers on overall COVID cases in the hospitals. You can see that those numbers are relatively low compared to where they were a month ago. So they have been coming down in the hospitals, and that's also true in the ICUs. The numbers are low. So around a quarter of the beds in the hospitals are COVID beds. So as I mentioned, we've been looking at the numbers recently at ASU, and if you take people who've been tested at will, that is to say anyone who just shows up at a public site, and look at the positivity rate there compared to places that are doing routine screening, places where policies are in place to have people tested on a regular basis, the burden of virus is much higher in the public, at will testing than there is in places that are kind of constantly monitoring their populations. So there's definitely a benefit to having some structure and having some routine testing there. We've also been looking at variants at ASU. We are expanding the number of variants that we're looking at, roughly 400 a week right now, but we're looking to increase that considerably. We are seeing the California variant here in the testing that we're doing at ASU at least. And we are also seeing an increased percentage of positive tests due to the UK variant, which now comprises as much as 2% of the positive cases in our testing facility. So that variant is now definitely moving into Arizona, and there is some evidence that it's starting to spread more within the state. So we'll have to keep an eye on that. Probably worth mentioning again that in studies where vaccines have been used in places where these variants are endemic, the vaccines appear to be working fine against those variants. So for example, the recently approved J&J vaccine was tested in South Africa at a time when the 351 variant was predominant in that country, and still prevented, 87% of people from going into the hospital. So it still was quite effective at preventing hospitalizations there. So I think, at least for now, the variants seem to be managed well by the vaccines that we have available to us. The numbers on the vaccines continue to be very encouraging. So far, to my knowledge, nobody from any of the vaccine platforms has died within 2 weeks of receiving the vaccine, or certainly with any indication that it was a result of the vaccine. So the vaccines are quite safe. There are a few people that have had this, allergic reaction, primarily individuals who knew that they were at risk for that, but they have been managed. And then most of the side effects remain: sore arm, some fatigue on the second dose, sometimes a fever. The symptoms all resolve within 24 to 48 hours. So overall, the side effects are quite minimal. And overall, all of the vaccine platforms, certainly all three of the ones approved for in the US, work very well at keeping people out of the hospital and keeping away from severe illness. We are starting to approach the number of around 7% vaccination rate for both doses in this state, and I think generally speaking throughout the country. So it's a start. By no means do we have the majority of the population vaccinated yet, and we're nowhere near close to herd immunity. So there is still a risk that the virus could take off and create another wave of infections. And that's, I think, the big concern here, is that this virus tends to come in waves. It rises to this big surge, and then it comes down again, and then another surge can still happen. I think that those are all the kind of main points I have there. Some of you may have questions, and before we do that, let's have Dave Thomas give a report on the vaccination program.
Thank you, Dr. LeBeer. So my update is going to be a little bit brief, just giving a report out on recent numbers. So at Phoenix Municipal Stadium, we're looking at 64,700, and at State Farm 382, 383. So we are now at over 447,000 vaccines as of 10 a.m. this morning, and we'll definitely cross over the 450,000 mark today. We'll point out that if you look at the Bloomberg vaccine tracker, the mass vaccination sites that we're running are actually providing more vaccine than many nations around the world, and so you can find the data there. The state is continuing to open up new sites, and those sites we are not necessarily involved in, but I'm sure you're aware there's a press conference this morning for the new pod in Chandler. And then, of course, the University of Arizona is operating a pod in Tucson. Planning is continuing on other pods around the state. So DHS is continuing to provide additional locations for vaccination. And so that concludes my report. Back to you, Dr. LeBaire. Thank you.
Hey, David, I wanted to just ask you if you might speak to the point of the duration of our testing sites. Those are in place for the foreseeable future. Is there a time limit on that?
There's not a time limit. I mean, Jay, it speaks to there is a tremendous amount of discussion and planning around how we're going to handle the heat as the temperatures begin to rise. We have, of course, provided testing through the summer months last year, and we have learned quite a bit on how we keep our staff cool. And we do have plans in place, and as well as we're looking at other locations that might be indoors, for example. So definitely working through mitigation strategies that we would implement over the course of the next 45, 60 days.
Thank you, sir. Appreciate that. Open it up to all of you for questions for either David or for Joshua.
Hi, Dr. LeBaire. It's Joanna Allhands from the Arizona Republic. I had a couple of questions. On the numbers that you were talking about of the people that had been tested at will at public sites versus routine screening, is that something we can get? Is that data that you said you've released?
We haven't released that data yet. Thank you for asking. We're working on putting together a publication, so the results are still a little preliminary. But looking at the charts, it was a decided difference. I mean, and it's not a total surprise. Our experience here at ASU has been, since we do routine testing among our student population as well as our employees and staff, we have had a much lower rate of infection within the university than in the public at large. And I think that's largely because of the constant monitoring and the practices in place. So we're seeing the same thing with other partners who've had those sorts of practices. So the data are not out yet, but they are coming.
Okay, that's great. I would definitely love to see that data when you guys have it.
Sure.
And the other question that I had just was with the state kind of changing its approach on vaccination this week, kind of moving more to an age-based thing. I've seen a whole lot of different discussion about this, what's best and how to, reach the most people versus ensuring equity. Do you have kind of a sense of, is there kind of the best way to do this? Is there kind of a sweet spot of where to get in between, having huge sites and small sites? Vaccinating by age, vaccinating by existing condition, all the different things. I mean, is there kind of a sweet spot of what's going to make the best combination for people?
I don't think we have a simple answer for that. I know there's been a lot of discussion, and the National Academy of Sciences has weighed in. And, I think overall, the two highest risk groups obviously are people of older age and people with other underlying conditions, particularly diabetes and a few others, that put them at high risk for negative outcomes. If we had a magic test that could tell who was at the highest risk, that would be what we would use, but we don't have one. So, we just need, the two things we need is to, I think we do need the 1B group and the 1C group, which are basically the older age group and then the people with other conditions. Those would be the highest groups to focus on, mostly because by vaccinating them, we could reduce the need for those people to get ill and end up in the hospital. And then, of course, the other big need is to get as many doses out as possible. And there is encouraging news that the mRNA manufacturers have improved their manufacturing capabilities and should have higher dose rates coming out soon. And of course, the addition of the J&J vaccine is a huge advantage because it's a single dose vaccine and it's also effective.
Hi, Dr. LeBaire. Sorry, Carissa with 3TV and CBS 5. Are you concerned or should we be concerned about Texas getting rid of its statewide mask mandate? We know people travel and they can spread the virus. Could that impact our numbers here in Arizona?
Right. Well, it's an odd time to be relaxing on mandates for wearing masks. Obviously, we are still hovering at over 1,000 new cases a day in our state, and all the states are hovering at a higher level than they were at when people reached a low earlier in the fall. And so there is a risk of another surge, and the CDC has been pretty clear that they are concerned about another surge. It's complicated. The math is complicated because, we are starting to vaccinate people, although we really have not vaccinated that many yet in terms of the overall population. And it's important to remember that the vaccine is, even as we're giving the vaccine to older patients, or older people, I should say, remember that 25% of the people who died from COVID in Arizona were middle-aged and younger. So this virus still kills younger people. It's not like heart disease and cancer, which really are primarily older people diseases. This virus does hit, younger people. In fact, a couple dozen children died. So it's something that we have to pay attention to. And as you say, there is a neighbor effect. If our neighbors are relaxing their conditions and there is an increased spread there, then that could certainly impact nearby. I don't know what the travel rates are between Arizona and Texas. I'm sure they're not zero. And so, obviously we have to be concerned. I'm hoping that people can hang on a little bit longer with, following guidelines, at least until we can reach the herd immunity. At that point, I think there will be a lot of changes that we could all embrace.
Hi, Dr. LeBaire, Kevin Pierpont, Cronkite News. And just to piggyback off that question and your response, at what percentage of the population would you feel comfortable to begin relaxing some of the restrictions that we have in public and mask mandates?
Right. Well, I think we're looking to get somewhere between 70 and 80% immunity. If we had between 70 and 80% immunity in the population, there would be very little risk of big outbreaks in terms of a pandemic or epidemic response. Now, I should be careful there, because even when you reach herd immunity, that doesn't mean the disease goes away. We already have herd immunity for measles, right? But we still have outbreaks of measles. It still will crop up. But we're not seeing an epidemic response to measles because we have herd immunity. And I think at that point, if we could get to 70 to 80%, that kind of herd immunity, I would certainly feel more comfortable about opening things up. And of course, our goal really should be to get everybody vaccinated, because if we could do that, we could really very significantly limit severe outcomes from this illness.
Dr. LeBaire, Carissa with 3TV and CBS 5 again. You said that ASU COVID testing, through the way you guys do it, you were able to find a couple of cases of variants. I'm just wondering what the status is now with the testing. How many variants are you guys uncovering, and how big of a problem it is? Right. We're trying to get that up on our website so that you could actually track it from a chart, and that should be available soon. What we have seen, though, is there's definitely an increase in the UK variant, to be specific. So the way we do our test, we can detect the UK variant by a pattern called an S gene dropout. S gene is one of the genes in the virus, and our test tests for that gene specifically in the region that gets deleted by that variant. And so we get a very specific pattern that, although not a perfect match with not all of them are UK variants, the vast majority of them are. And we are seeing an increased number of those variants in the state. We're seeing it, it's been growing ever since the beginning of the year. And it now comprises a couple percent of the positive cases that we observe. So it is definitely growing in the state. And we will just have to keep tracking that. The more spread there is, of course, the more that may start to predominate. And the thing about the UK variant is that it's more contagious, but not necessarily more deadly, right? That's correct. That's what we observe right now. Yeah, so it is definitely more transmissible. I should point out that the vaccines that we're currently using protect against it. So if you get vaccinated, there is if the vaccine will work against the UK variant, as it appears to work against all of the other predominant variants that we're concerned about.
Anybody else?
Yeah, hi, Caitlin Keenahan, Cronkite News. How concerned are you about people not coming back for their second dose of the vaccine? Last week, Dr. Kara Chris said that somewhere between 10 and 20% of second vaccine appointments are missed. Is this concerning when we're looking at fully vaccinating the total population and getting that herd immunity? And how does that kind of factor into the 70 to 80% vaccination rate that you are saying is our goal?
Well, the best data we have and all the clinical trials that we've used were on people who received 2 doses of vaccine for the 2 mRNA vaccines that we're using. And ideally, we really want to get everybody to get both of their injections because there is better protection for sure. There have been reported cases of people who had only 1 dose of vaccine and who later then were infected with the virus. That said, there is still a substantial boost in immunity just from the first dose. Some of the data that were reported recently from Israel suggest that even by achieving 1 dose of vaccine for their population above 65 before they got their second dose, they were already seeing a significant drop in hospitalizations and even a decrease in transmission of virus, which is extremely encouraging. So I think, we really want everybody to get both doses, but I'm not worried that 10% of the population isn't getting it. I would love to see them get it, but I think we will still get a lot of benefit just from the single dose if we, in terms of overall population protection. It doesn't protect those individuals as much, but it definitely does protect the population.
Anything from anyone else?
Yes, I'm Corey Ball from the Walter Cronkite School of Journalism. Dr. Anthony Fauci recently stated that even with widespread vaccinations, that it is possible that the masks will not go away. What is your opinion to this?
Well, I believe that once we get the vast majority of the country vaccinated, that while mask wearing won't go away, it will be largely reduced. There will always be some people who are concerned, particularly people who have a high risk of negative outcome, or certainly if people do get sick, it would be a reasonable thing to wear a mask. I'm hoping that our culture is now becoming more accepting of masks. There are other countries, particularly in the East, where mask wearing was common well before COVID-19 when people were ill. And I think it's a courtesy that you do to your neighbor and friends by wearing a mask when you're ill so that you don't spread any kind of infection to them. But I do think that it will go down considerably. I think, I'm hopeful that by the end of July, when most everyone who needs a vaccine can get one, we can get back to some degree of normal life and start interacting again. Already, we are recommending that people who are interacting with others who have also been vaccinated, so people who are all vaccinated, should be able to get together now without masks. That should be okay. So if you've been vaccinated and you want to go visit your parent who's been vaccinated, you should be able to do that without a problem. We're still recommending mask wearing when you're around people who have not yet been vaccinated because there is still a risk there. But once everybody's been vaccinated, I think the risk goes down considerably and people should be able to reduce mask wearing a lot.
Okay, not hearing any more questions. We will bid you farewell and see you again next week. Same time, same day.
Great, good seeing everybody.
If you have any follow-up, you can reach out to myself or to Sandy Leander. Thank you.
All right, take care.